Before surgery checklist. The first thing on the checklist is to make an appointment with your primary care physician. This appointment needs to be done 30 days before surgery. The second thing on the checklist is to contact all of your insurance providers. This includes Medicare. Ask if you need a pre-authorization, pre-certification, any second opinions, or referral forms if they are needed at this time as well. The third thing on the checklist is to complete any dental work beforehand. This needs to be done 30 days before surgery. This includes a basic cleaning. We also ask that any non-emergent dental work after surgery that you consult with your physician before any of this work needs to be done. The next thing on the checklist is we're going to talk about a pre-admission phone call. This phone call is done 1 to 3 days before surgery. This phone call is lengthy. It's about 20 minutes in length. They're going to go over what to expect day of surgery. We're going to go over what time to stop eating and drinking, what medications to take morning of surgery. Again, this is a really important phone call, so it's important that you have that they have all of your attention. So block out a good period of time for this phone call. Last thing on the checklist is to remember to tie up any loose ends. So this includes your family, your support systems, your friends. So think about things like some last minute shopping, that grocery list, your pets, your things like that, paying some last minute bills, those sorts of things. So tying up some of those loose ends, some of those things you don't want to think of, that first week that you get home from surgery. Preparing your home. The first thing we're going to talk about is meal preparation. It might sound kind of silly that we're talking about meal preparation, but who wants to talk about meal preparation when you're talking about recovering from surgery, from a major surgery? So if you can plan ahead a little bit and think about some of this stuff before surgery, this will make it easier after surgery. So can you make a few meals ahead of time and put them in the freezer to make things easier for yourself after surgery? Can your family or friends help you with this after surgery? So again, just preparing for yourself before surgery to help you on the backside. The second thing on the list is comfortable furniture. So nothing too fancy, just a couple asks. As far as the seat of a chair or a couch goes, we want that seat to be not too low, not too high, right at your bottom level. And as far as the arms go, we want all chairs to have arms. We want to be able to lift off from a comfortable seat. Those chairs will provide you comfortable stability to get up and down from. So again, the chair to be right at bottom level, and then the chair to have the arms are very important for support. The next thing on the list is to have items within reach. So we talked about having the comfortable chair. Get that chair set up ahead of time. Get that box of Kleenex, get your iPad, get everything within reach and ready for you before you get home. So things are all within reach ahead of time. The next thing on the list is removing the trip hazards. Remove the rugs, remove the cords, getting things as clutter-free as possible. Putting those non-stick mats in the bathroom. You've thought about it beforehand, before surgery, but do it now. Now is the time to do it. So putting those non-stick mats in the bathroom, very important. Consider a shower and a raised toilet seat in the bathroom along with side rails. The last thing on the list is to make sure your walker fits through all of your doorways. We recommend that you visit with physical therapy prior to surgery so you can practice your exercises. This will strengthen the muscles around that joint prior to surgery. When visiting with physical therapy, they will recommend pieces of equipment that will be helpful in the recovery period. Please see the list below. Check with local pharmacies, medical supply stores, VFWs, American Legions. Remember, not all vendors carry all equipment. Check with your insurance plan, but the key is to have your equipment beforehand. A special antibacterial wipe or soap may be prescribed to help reduce the number of germs on your skin prior to surgery. This soap or wipe will kill germs up to 24 hours. Follow your doctor's instructions on when to use the soap or wipe prior to surgery. Do not use lotions, powders, or creams after the shower. Night before surgery, morning of surgery. Nothing to eat after midnight. More details will be given during that phone call we mentioned earlier. Follow the orders from your doctor as far as what medications to take morning of surgery. Leave everything valuable at home. This includes important jewelry or anything that really means anything to you. Just leave it at home. Other things to bring with you. This guide has important notes that will be used from beginning to the end. It houses valuable information, so bring this guide. It's a valuable tool. One last thing I'm going to mention on this list is your home medications. Leave your home medications home. The only thing medication related we need for you to bring is your actual home medication list. Here you can see a list of other things to actually bring to the hospital with you.